Well, welcome to this video. So it's often said that if you are wise, you will learn from your own mistakes. But to be wiser still is to learn from the mistakes of others. I don't do too well on either of those personally. But we can learn from the mistakes of others, and we can learn from what others do right. And this is the case in Japan. Now, I remember seeing pictures. Someone sent me pictures from Japan back in apple blossom time and cherry blossom time in spring. And people were sitting around, okay, they're in the open, but they were sitting around in groups, they were talking, and normal socialisation seemed to be going on. And I was concerned at that time. And then, of course, the Olympics had to be cancelled, as we know. Still an open question as to whether the Olympics will go ahead next year. I think it unlikely. But things we can learn from Japan. And I'm going to start off by referring to a study, then doing a little bit of background on Japan. And then later we'll be talking to Jenny, who lives in Tokyo as well. So interesting things here. So this was the study, Dynamic Change of COVID-19, Seroprevalence, how many people were testing positive for the antibodies. Amongst asymptomatic populations in Tokyo, how many people were testing positive who were having no symptoms? Because you might remember we had this sort of classic strange curve. We had this peak here in the early days. And then things went quiet over summer. Then later summer things went up and then went down again in Japan. And they're fairly levelish now, I think you would have to say. But these numbers are very low. I don't know if you can see that, but that line there is 500 cases per day. There were 500 cases per day in the United Kingdom, if only. Because when you consider the population of Japan, it's quite a populous country. 127 million people, but they've had 90,000 cases and deaths 1,631. Now, this would lead you to question the number of deaths. It seems hardly believable, virtually unbelievably low. But record keeping in Japan is actually very good. The Japanese are very fastidious record keepers. So I actually believe these numbers. So we've got a large population. We've got relatively low number of cases, and we've got an incredibly low number of deaths. Wow, I wish it was like that in the UK. I wish it was like that in the United States. I wish it was like that in France, Spain, but it's not. So what can we learn from this situation? Fatality rates low compared to Western countries, decreased despite absence of lockdown. Now, there has been restrictions in Japan, but there hasn't been a full lockdown the way there has been in the UK, for example. So I think there's two questions here really. One is, has the virus not spread in Japan? Has the virus not spread? Have they not really had the infection? Is there a low infection prevalence? Is it that the virus has not spread and not many people have been infected? Or is it that a lot of people have been infected, but many have been asymptomatic, minimally symptomatic, and very few have died? So which is the case? Is it low infections, or is it low infection fatality rates? And this study pretty well, I think, answers that, and it's consistent with other data. So the seroprevalence amongst asymptomatic employees in Tokyo. Now, this study is not peer-reviewed. But I've read it, and I think it's a good study. Not that that means much, but I think it's a good study. And I'm sure it will be accepted for publication in a standard journal any week now. The process can be a little bit lengthy. So it's looking at seroprevalence of asymptomatic employees. Now, the thing about this study is it's the employees, although they all worked in central Tokyo, they came from all different parts of Tokyo. Greater Tokyo is a huge area. And they came from different areas, and they, for the vast majority of them, they didn't socialise, they didn't travel together, they weren't friends, they didn't really meet with each other much. So their only commonality was that they worked in central Tokyo from many different areas. And the data was taken from May the 26th to August the 25th, which of course corresponds to, I mean, if we're looking here, the data was started taken in May, that's about here. And it was taken to August the 25th, which was when there was a lot of, so that's when it started. The data was collected roughly from there to there. From when there was few cases to when there was, well, they'd been over their peak then, hadn't they, of this apparent second wave, albeit at a relatively much lower scale than the similar peaks we've looked at in the UK, for example. Now, what they did here is they had healthy volunteers. They started off with quite a lot of healthy volunteers. And they did tests for immunoglobulin type M and immunoglobulin type G. Now, these are the antibodies. Normally, the IgMs are made first and the IgGs are made slightly later. And the test was repeated in a month to see if they changed. So did they start off negative and become positive? Did they start off positive and become negative? That was the aim of this research. Now, symptomatic patients were excluded. They didn't want people with symptoms, so they didn't have those in. And they were looking at seroconversion. Now, seroconversion means you go from negative and you become positive. You seroconvert as you make the antibodies, as you make the immunoglobulins. The immunoglobulins and the antibodies are the same thing. But they were also looking at seroversion. And seroversion is when you were positive and then you become negative. So they were looking at that as well. So that's the opposite process. So seroconversion is becoming positive for antibodies. Seroversion is reverting to becoming negative for the antibodies, because we know the antibodies don't last for that long. So they ended up with 615 healthy volunteers received at least one test. There's always, these things never quite work out. It's a pity they didn't get the whole number. I don't know quite what went wrong there, but anyway, they got rigorous data from 615 healthy volunteers, at least one test. Now, seroprevalence increased from 5.8% of the population to 46.8% of the population over the summer. Wow. So we started off at 5.8% of the population had been exposed to the virus, and then we went up to 46.8% of the population had been exposed to the virus as detected by the antibodies. So what this is saying is actually probably more than half, we'll see why it's probably more than half later, probably more than half of the workers in Tokyo were exposed to SARS coronavirus 2, and most were asymptomatic because symptomatics were excluded from the study. I mean, this is just incredible. Half of the population has been exposed, and yet 1,631 deaths. Quite incredible. Fascinating. Let's delve further. Now, the parallel of the rise in daily confirmed cases within Tokyo, right, paralleling. So what this means is that as the daily cases of diagnosed disease increased in Tokyo, which those figures are, so the antibody prevalence increased at the same time. Now, this is important because it gives us what we call a temporal association, an association in time. As one increased, so did the other. So what this means is the increase in the antibodies was probably directly associated with the increasing number of positive antigen tests. In other words, this does represent genuine spread of the virus throughout the population. That's what this indicates, and it indicates it fairly strongly. So paralleling the rise. Excluding individuals with clinical symptoms probably meant an underestimation. So this figure here, this 46%, is only people that were asymptomatic. So if you add on, I don't know, another 10-20% of people that were symptomatic, we're getting way more than half of the population have been exposed to this virus. So much greater spread of the virus than anywhere in, even New York didn't have anything like that numbers. Much greater spread of the virus than London or New York, for example, and yet way less symptomatic cases. Peaked on the 4th of August, so the antibody figures peaked on the 4th of August, and if we remind ourselves of the graph, that's at the peak of the That's at the peak of the positive antigen tests as well. So it all fits together really quite nicely. Now, as we say, that correlated with the peak of the second wave, or the so-called second wave in Tokyo. Out of 350 individuals who completed both offered tests. Right, this is interesting. So some people only had one test, some people had two. 21% who tested seronegative became seropositive. So this was the switch. So the 46% is the overall number who were seropositive, but 21% who tested seronegative became seropositive. In other words, they seroconverted during the time of this study, from here through to there. Seroconversion was found in 12% of people. Seroconversion was found in 12.2% of initially seropositive patients. Now, I've said that wrong. Seroversion. That's seroversion. So seroversion was found in 12.2% of people who were positive. So 12.2% of those who were positive became negative during the month. People were losing the antibodies. They were seroverting. They were becoming negative again. So 21% who were negative became positive. They seroconverted. And then 12.2% of those who were positive became negative. They seroverted. That's the right way around. Now, 81% of the IgM positive cases at the first testing became IgM negative in approximately 1 month. That's not surprising. We would expect that. But it's always good to know that normal physiology is being respected here, because the IgMs are produced first. The IgM antibodies are produced first, and they don't last for as long. There's something else that this showed. The people that were immunoglobulin M positive and immunoglobulin G negative was the least common combination, 0.4% of people. So that means there's a short time between developing the IgMs first and the IgGs second. In fact, in most cases, there'd probably be an overlap. But again, not surprising, but it is good to know that if a study parts from what you understand from the normal physiology, you've got to worry about the study being correct, but this doesn't. So no surprise there, but nice to have it confirmed. None of the seroconverted individuals, none of those who became positive, were hospitalised, and none died. Wow, none. This is really quite amazing. Conclusions. COVID-19 may have spread widely across the general population of Tokyo. Yes. Despite very low fatality rate, temporal correlation between the rise in seropositivity and the decrease in reported COVID-19 cases. What do I mean here? Well, as the number of people that were seropositive increased, as the antibodies increased, the number of new cases started to go down. This indicates that there is community immunity operating in Tokyo, or if you want to call it herd immunity, it's the same thing. So it looks like the virus has spread through Tokyo, but people have not got sick and not died. You might call that an ideal situation, or very few have got sick and died. I mean, that number there of 1,631 deaths is for all of Japan. All of Japan, with a population of 127 million. We could have worked out the infection fatality rate. It would be nicely low, wouldn't it? How do we explain this? Right. Local observations, as we'll see from Jenny in a minute. It's part of the Japanese culture to wear masks. They had a cultural advantage. It's a non-tactile culture. They don't hug, kiss and shake hands very much. They tend to bow. It's a quiet culture. They don't talk or shout or sing on public transport. They don't even talk to each other much on public transport. And of course the public transport was clean and there was reserved seats between the two. There's also a culture of ventilation. They like their fresh air. Now, all of these things here, all of these things are not going to stop the virus spreading altogether. It can still spread. But what it means is people will be infected with a very low inoculum. If they're infected, they might only be infected with a few hundred viral particles, whereas in a tactile culture, who don't wear masks, who shout loudly at each other and talk loudly all the time and don't ventilate, then the inoculum would be much higher. They would be receiving a much higher viral load. So is it the fact that these measures that are largely cultural in Japan, so they took to it quite easily, that these measures are reducing the viral load that each individual was exposed to, giving many more cases that were asymptomatic or minimally symptomatic? Interesting question. I think the answer to that is yes. Do I have the scientific data to prove that? No, because the studies haven't been done. With influenza, we know it's the case. The studies have been done. But all these observations do seem to fit together to indicate that is true. So the applications are patently obvious, aren't they? Patently obvious. We need to wear masks. We need to be non-tactile for a period of time. We need to stop talking in public places loudly. We need to ventilate things. You know, the applications here are obvious. And if we do these things, does this mean we'll get the same sort of infection fatality rate as Japan, with a population of 127 million and well under 2,000 deaths? I don't know. But I tell you what, it's worth a try. Because given the price we're paying to restrict the spread of this virus at the moment, these are all simple, very low cost interventions. Not only are they low cost financially, they're relatively low cost culturally and socially as well. So definitely food for thought there from the Japanese experience. App use is pretty good. Domestic travel is allowed, international travel is not. International travellers that do come back have the full 14-day quarantine. And we saw the importance of this when we looked at Italy recently. And that quarantine in Japan is completely supervised. You either go to a quarantine medical facility or a quarantine hotel, and everyone, absolutely everyone, going into Japan has that 14-day quarantine. No exceptions, as there was in Victoria in Australia, for example. No exceptions. It's done well. And of course the Japanese diet is largely, basically the Japanese eat a large proportion of the world's fish, unfortunately. Now, we can't all eat huge amounts of fish. We need fish in the oceans to supply ecosystems. But the key component in the fish is fairly high in zinc, but the key component in the fish, as we looked at in the epidemiological data from Kerala and other parts of India, for example, is it's the vitamin D that makes the difference, in my view. So again, we see the correlation with vitamin D, again, strongly supported. Does that prove that the vitamin D is preventing the infections? No, it doesn't. Does that prove the vitamin D is causing minimally symptomatic or asymptomatic cases? No, it doesn't. We haven't got any studies that prove that conclusively. We've got some studies that indicate it's likely to be the case, but one or two small trial studies. But no government seems to have taken on large-scale testing, which is just inexplicable, and we've mentioned it before on this channel. But that is strong, again, correlation evidence, I would suggest, for the hypothesis of the vitamin D being so important. And one more. Can you guess what it might be? One huge difference between Japan and, let's say, for example, the United States. Want to guess one big difference? Obesity rates are very low in Japan and very high in the United States. BMI over 30, which is the international standard for obesity. Japan, 3.6% of the population. The United States, almost 10 more, 30.2% of the population is obese. Body mass index of over 30. Body mass index of over 25, people that are overweight. Japan, 24.7. United States, 66.5. Wow, what a difference. Now, we've looked at studies many times that indicate that obesity is a significant risk factor for severe disease. And we've looked at other studies where obesity doesn't seem to be a significant risk factor for severe disease, but more studies seem to be showing that obesity is a risk factor than that obesity is not a risk factor. So I would strongly suspect this is a difference that is probably having some causal effect. Huge differences. Obesity and overweight. The average person in Japan consumes over 200 calories per day, less than the average American, according to this ResearchGate study, which is an economic study. They drive less, they walk more, and they use more public transport. So I so envy the Japanese positivity testing rate and incredibly low death rate. And if we can implement some of these factors that I believe do seem to be making a big difference, and these are always posted in the description, of course, then the potential numbers of lives that could be saved, learning from the experience of Japan, is immense. Let us now talk to Jenny. Now, you might remember we talked to Jenny before. I can't quite remember when it was. Me and Jenny talk about that. Fascinating insight. Jenny's an international teacher, taught all over the world and been in Japan for well over a year and has been there all the time of the pandemic, so has got excellent on-the-ground insights to offer us. So thank you, Jenny. Let's go and chat now. When did we last talk? We were just saying, did you think it was June?
I think it was either like right at the end of May or the beginning of June. We were just getting ready to go on school holidays, and
And for the 2 or 3 people who've missed that video, remind us where you are, Jenny.
I am in Tokyo. So I live and work just in Mitaka, which is a suburb in the western part of Tokyo.
Okay. And how long have you been there for?
It's been about a year and a half. I've been here since July of 2019. Mm-hmm. It's hard to tell because I haven't really left my house much since March, other than going to work since August. So I know the inside of my house really well.
Yeah, indeed. So basically, I mean, there's been a lot of cases in Japan, quite a lot of transmission, but very few deaths, fortunately, and not a lot of people appearing to get ill. I mean, is that kind of your experience? Have you known people that have got sick or known people that have had this?
I have not known anyone personally that has been either tested or hospitalized. Wow. There was a case like in the international school circuit, which I work in, there was a teacher at a different international school in town that was confirmed diagnosed, I think last week or the week before last.
Right.
As far as people in my own work and school community, we haven't had any cases. Tokyo seems to be, it's been pretty consistent for the past several months. They seem to be testing 3,000 to 4,000 people per day.
Which is not huge considering the population of Tokyo.
No, the population of Tokyo, I think, is around 38 million, give or take, a little bit of change. And the highest that I remember seeing was 476 cases, which I think was back in July. We've been kind of bouncing around between 100 and 300 cases for probably the last month or so. I think I looked at last night and it was like 78. But I would say it probably hovers somewhere around 150, 200 every day.
And nationally, I think you're only on about 500 or so cases a day at the moment. So way lower than Europe, way lower than the United States.
Yes.
It's interesting. Almost like something strange is going on, really.
You know what it is? I really think it's because everyone wears a mask. Like I very, very rarely see people that aren't wearing masks. And
so tell us about your last trip out, Jenny. What did you see?
Yeah, so actually, we're on a little school break for the past couple of days, and so I decided that I would go downtown, and so I went and stayed at a hotel in downtown Tokyo. And so from my house, I took a train. Actually, took a couple of trains. Everyone on the trains is wearing masks.
Everyone.
Everyone. I saw one person in 2 days, and I think I might have seen 1 or 2 children not wearing masks, but I saw one adult in 2 days not wearing a mask on a train, and then just out and about, I might have seen another person not wearing a mask.
Yeah,
It's
virtually universal.
It is.
And is it mandated, or is it just highly compliant population?
I think it's highly compliant population. I think it's mandated, but there's no recourse if people don't wear masks. Even back when we were having more of a lockdown, there was no legal mandate. It was just, we highly recommend this. We can't force your business to close down, but we'd appreciate it if you did. That was kind of how things were. And as of now, there really aren't any closures that I'm aware of. I'm not, I'd have to check and see what our level is. I think we get a level 2 or a level 3, which means most things are open. I think large gatherings are limited to 5,000 people, which is seems a little
yeah, it's loads, isn't it? Yeah.
I won't be going to any of those.
Yeah.
Just out yesterday, I was in Ginza, which is downtown Tokyo, kind of like, Fifth Avenue of Tokyo, or Oxford Street, I guess, in London, and everyone was wearing masks. I went to a couple of different stores. Every time you walk into a store, hand sanitizer, people taking temperatures.
Yep.
Everyone's wearing a mask. The hotel that I stayed at, similar. You walk in, there's hand sanitizing stations by the elevators, at the lobby. When you walk into a restaurant, they take your temperature. And I would say this is the most that I've been out since March. And I felt pretty safe. I mean, I did my best to keep distance from people. And so, you have those mixed feelings of, am I being safe? Am I taking a big risk here? But I do feel that just being around other people, that everyone's very cautious. I think another thing that's helpful on trains is people generally don't talk.
Yeah.
Way here. So
is that normal in Japanese culture, or is this changed?
No, that's trains are usually silent, and if you're having a lot of conversation, people will give you the side eye. They're like, "What are you doing?" It's just it's not acceptable, really, to have loud conversations or even any conversations on train. Most people are sleeping with their long commute.
We've got 2 cultural aspects here, haven't we? The mask wearing, which is cultural anyway, and the quiet behaviour in public, which is also cultural.
Absolutely.
And that's carried on into this pandemic era. Are people wearing masks indoors and outdoors, Jenny?
Yes. That I've seen. Even in my own workplace, everyone wears masks unless you're in an office by yourself. Oh, my cat came to say hello.
He's welcome. Bring him on.
Oh, this is Dublin.
Hello, Dublin.
The internet.
Hello, Dublin. We had a goat on a video recently. I don't know if you saw that one.
I didn't see that one. I'll have to check that out.
Yeah. So anyway, hand hygiene's good. Yes. Face covering is good. Hands, face, space. I mean, what is Japanese culture like? Is it a fairly sort of in your face kind of culture, or is it a more sort of step back type culture?
More step back. There's not, handshaking isn't really done even pre-pandemic. People tend to bow. And so a lot of bows and smiling behind masks. But it's not yet. I would say that personal space is smaller than what I would be accustomed to in the United States. But even with that smaller personal space, people don't really get into your personal space in a way that they might in other places. Like when I was living in China, there wasn't a personal space. In Japan, there's definitely more people are polite. I think that's part of it too, right? People tend to be very polite. They tend to let other people go in line in front of them.
Yeah.
And I think that helps.
Just and there's not really any hugging and backslapping and sort of, that's not culture. I think late night after hours in bars, sure. That's where that happens, and I think that's a few drinks later. But yeah, I mean, if I met you as a friend in the street, I probably wouldn't hug you in the street or
no. And interestingly, I think most of the transmissions they are attributing to occurring in bars and casinos and hostess bars. And so that's really.
Is hostess bars a euphemism, Jenny?
You can look that up. Yes, okay. It is.
Okay.
Yeah, I mean,
it sounds like a euphemism. Yeah,
host and hostess bars. Yeah, and so there's all sorts of different services people can get at a host or a hostess bar.
Sure.
So.
Now, what is Japanese culture like in terms of ventilation? In England, we always shut the doors and, oh, there's a draft, close the door, shut the window. You know, do Japanese like their fresh air, like the German culture, or do they kind of?
I would say so. Like in my own, so my house is very much Japanese style, and upstairs, like all of my bigger windows have screens. People dry their laundry outside on their. When I was on the train today, the windows were down in the train cars, and so I would say definitely ventilation. From what I've experienced, people do tend to keep their windows open, and you know, that's part of what people tend to do.
Interesting. So we've got the hands, face, space, ventilate as part of the culture here.
Now, I will say that spaces here are pretty tiny comparatively.
Oh, right. Okay. Yeah.
And so I think, you know, when people have the ability to ventilate, they do. You know, some apartments in downtown can be, you know, 20 square meters.
Yeah, sure. Yeah.
So, you know, I live a little further out, so my house is quite a bit bigger than that.
Yeah.
But I do see that people who are able to ventilate, that generally, you know, that people like to have windows open when they can.
Right, so they get good marks on the hands, they get good marks on the face for the masks and the not talking in public. They get some good marks for the lack of physical contact, but not so good marks for the smaller apartments that are sometimes there. But they get good marks for the ventilation, so they're doing pretty well. It's kind of 9 out of 10 here, isn't it?
Yeah, and you know, and I feel fairly safe. You know, when I go out, I know that people are going to be wearing masks. I know they'll be keeping their distance. Even still, when I go into the grocery store or into a convenience store, people are still sanitizing, those kinds of things. And so I think people are being very cautious whilst managing to have a life that's a lot less restricted than what my family's seeing in the US.
Yes, life is fairly free there at the moment.
It is, and it really has been. I think the only time that there was a state of emergency, I think it was right before we talked, that went from the end of April and through most of May, and there has not been another state of emergency since that time. Cases definitely went up a little bit in the summer, and I think
in August, but bars were open in that time, were they?
Yes, they were.
Are bars open now?
I believe so. They have limited hours at some points. Restaurants need to close by 10 p.m. But that was like one of the few restrictions that came and went and then came back, and I think it's now not restricted at the moment.
Are people using the contact tracing app very widely?
There is the contact tracing app. I've got it on my phone. I think because only people who have been diagnosed, and people are still being put in hospital when they're diagnosed. Either you go to hospital for treatment, or you go to a hotel that's been designated for those that are.
So they're not sent home and told to self-isolate.
No, people are still put in. Either
supervised.
Those options, right? And so I think that and I believe it's still relatively hard to get a test here as well. Now, if you're flying into Japan, everyone that flies in gets a test at the airport and can't leave the airport until their test results come back. That is one thing that's happening. And also travel restrictions here are still really tight. Can
you travel to different parts of Japan?
Yes. Within Japan, travel is not restricted. But people coming and going from Japan is still very restricted. They are finally recently let back in permanent residents with of other citizenships, and so for a long while there, only those that had Japanese passports could fly in and out of Japan. And so I knew a lot of people that weren't able to get into the country, and that started loosening up probably August, September. So we still have families at my school that ran into that have slowly been trickling back in over the course of the semester because they had left and then they weren't able to come back. That's eased up. They're also looking at easing restrictions. There's rumors that that's going to change. there's still a lot of paperwork that you need to do if you do travel internationally, and there are rules around using public transit. You still have to quarantine. They're talking about dropping the quarantine. So I think there's a lot in flux right now. It will be interesting to see when those things change, what happens. I would imagine more international travelers coming into Japan will probably increase the number of cases. I think it stands to reason.
Yeah. So interesting things that they're doing, right? That the isolation that people go in is for a full 14 days, presumably, is it, if they're tested?
Yeah, it is.
And then that's super. Now, who pays for that? Do you know?
I'm not sure. I would imagine.
I imagine it's the government that pay for it if it's Japan. They normally.
I would imagine. Healthcare is paid for by taxes and by the government, and so I as far as I know, that would be something that the government would pay for, but I'm not 100% sure on that.
So we've got this we've got all these factors here. We've got a remarkably low death rate, despite Japan having a relatively elderly demographic.
Mm-hmm.
I mean, the reason I'm so interested in this is it really stands out as an exception, doesn't it? Amongst, if we're comparing, say, Belgium, Netherlands, the UK, United States, Brazil, it really is an exception to all these. And I think you've identified some really, really useful characteristics there, and everything you've identified is cheap.
Right.
I mean, what does it cost to wear a mask, or not yell on the subway, or open some windows? All these things are free, basically, aren't they? And
they are, yeah.
And yet we're running up, untold billions of dollars of expenses for this, when we could be massively reducing the incidence with these simple, essentially zero-cost behavioural interventions. It's
right. And then with that behavior as well, you have more freedom to
exactly
live a little bit more normally. I'm still very cautious. I haven't been on a bus yet, because that is a bridge too far. But I think the trade-off, of wearing masks and keeping distance and being polite and all of those things is that you have a degree more freedom than you have in a place where people refuse to wear masks.
It's a very good point. People talk a lot about freedom, but the people you're intermingling with now have actually practically more freedom than people that shout a lot about freedom.
Yes. And it just takes a mask. Like, that's, masks and hand washing and being considerate of other people.
I'm actually somewhat amused by the ironic point, but it's yeah. Now, Japanese culture and the sun. Do people sit out in the sun in Japan?
Not really. People are definitely outside. Today was a holiday. It was Sports and Health Day, I believe. But people are out in parks. People tend to cover up. Like, women don't like to be tan. There's definitely, they
like to be a light color.
Yes. And so people tend to, even on bikes, like, people wear like sleeves from here to here, to keep from getting sun. And so there's not a sun tanning culture, but there's definitely an outdoorsy culture. People go out and walk, people exercise. Yeah. I see elderly people out with their walkers or in their wheelchairs out getting exercise every day. And so there's definitely an outside culture, but not so much a sun tanning culture.
Do people still eat all the fish they can get in Japan?
There's a lot of fish in Japan. Yes. Yeah, definitely.
Yeah.
And definitely vegetables as well, like rice, vegetables, fish. I mean, sushi isn't just a stereotype. It's a real thing that people eat a lot of. And you can get decent sushi at all of the convenience stores.
And seaweed.
Yes, lots of seaweed.
Yeah, interesting. Now, is taking vitamin D part of the culture? Do you know? I mean, do people take vitamin supplements? Are there any foods fortified with vitamin D? I mean, you probably not sure, but
no, I'm not sure about that. I know, like, I get my vitamin D on Amazon Japan, so you can definitely buy it here. There are sections in drugstores for vitamins. And so people do use them, and you can get aware of them. I'm not sure what kind of a campaign has been happening with vitamin D use.
You haven't
in
read
Japan.
anything in the popular press that's sort of promoting
Haven't
vitamin D?
haven't seen anything.
Yeah.
Doesn't mean it doesn't exist. I just
Sure.
haven't seen it in any of the articles that I've read.
But the fish eating is the big one, isn't it?
Yeah, fish is
Yeah.
definitely fish, and then I wouldn't just the grains and the vegetables either, because that's
Indeed.
also part
Indeed.
of the Japanese diet as well.
I don't know if you've seen any of the videos we made with Rahul he's from Kerala in India, and he noted that in the 1918 pandemic, the people in the fish eating areas got way less disease than the people in the vegetarian areas, and he's noticing the same pattern now with COVID.
Interesting.
And he's attributing that very much to the vitamin D, not to the fish eating.
Okay.
So while fish eating is very much part of Japanese culture, I'm not sure we want to massively encourage huge amounts of fish eating, because we need some fish left.
Right.
And we need to think about fish welfare as well. But the fish contain the vitamin D, and this really does seem to be the factor. And I'm just wondering if that's a major factor in Japan as well.
I imagine. I mean, it is a big part. It's a staple in the Japanese diet. No doubt on that. Like it's very common. I'd say people eat fish several times a week. Yeah.
But that combined with all these cultural factors, so you've got, and these factors, of course, are additive. The hand hygiene adds to the masks, adds to the none shouting, none singing, none talking in public, adds to the ventilation, adds to the app use, adds to the travel restrictions, adds to the well supervised isolation, and now adds to the high vitamin D in the diet. So I think, and all of these interventions are cheap. We could be doing all of these interventions.
I wish we would.
Yeah.
Let's give it a try for 3 weeks and see what happens. Like, what would it hurt for people just to
absolutely
try it?
To just copy Japanese culture for a little while. It's
it'd make me feel a lot safer for my friends and family back in the US for sure, and other places in the world. So
indeed. Yeah. So any other observations about Japan, Jenny? I think, are they the main things, do you think, that those cultural behavioral aspects, the diet, the lack of travel, anything else that's kind of struck you as living there that you think might be?
I really think that the almost universal wearing of masks is really hands down. And I mean, it's just everyone wears a mask. Yeah. And
the lack of infections are there, and the lack of fatalities are there to prove that.
Yeah, and I mean, it's still here, obviously, but it's so much lower than it probably should be based on
absolutely
the population and the density of Tokyo as well. It's such a densely populated city that you would think with the density per kilometer, per square kilometer, that it would just roll through Tokyo, but it hasn't.
It hasn't, no. Or hasn't rolled through Tokyo symptomatically.
Right.
Because we're looking at data that shows that high proportions in Tokyo may well have been infected, with minimal or no symptoms.
Yeah.
And the other thing that kind of my mind's thinking now, the mask wearing, it might not stop people being infected, but they can get a lower viral load.
Right.
And it's looking very much like the lower viral load people are much more likely to get minimally symptomatic or asymptomatic disease. Now, there's no scientific experiments done on that at the moment, but that does seem to be the case. If that is the case, then it may be that there's been, who knows, 50% of the population already infected, but the vast majority of those being asymptomatic or minimally symptomatic.
Right. And it's also hard to know because the testing has been so low here too, which, like, unless there were massive antibody testing.
Well, the antibody surveys that we're looking at do seem to be showing high seropositivity. So what that means is there's probably already a degree of, whatever you want to call it, community immunity or herd immunity there already, because the greater the number of people that have it, that's going to start to slow the spread down. So it could be that It could be
Right.
that Japan is at least 50% or more the way through this pandemic.
Let's hope.
Yeah. We'll know all this eventually.
Right. Yeah. Give it a few years on the other side to research, but
the
right
question
now,
is, will I be in a reasonable shape to make the videos? And will anyone want to listen? Is the key question.
yes.
But
yes.
I'm sure we will know eventually. Jenny, that's absolutely wonderful. There's no substitute for on the ground experience like you've just told us, and those cultural insights I just believe are so important. So
Thanks. Yeah, and I definitely lean a lot on my friends that are here that are Japanese to keep me filled in as someone who, is definitely a guest here, living
Sure.
here, and but I and many of my colleagues we say we're so glad we're in Japan writing this out rather than other places because it's just so much. There's more peace of mind here than I know I would other places, and it's pretty remarkable.
Yeah, I mean, I think that's all I wanted to talk about covered. Other questions do come to mind. I just really like to know how well accepted are you as a foreigner? Are you racially discriminated against, or are you?
I think having lived other places as well, I think there's always a sense of you being other when you're living in a place that's not your culture. And I am way not where I would like to be in learning Japanese. The first year here was having a new job, and then the pandemic hit. And so I just haven't had as many opportunities. And now I'm also doing some doctoral study right now. And so that eats up a lot of my time. And so, I know that I don't speak Japanese, and that's a hindrance. That said, people are very kind and helpful here. People go out of their way. And I think that's also cultural to help others. And, I've had times when people have stopped me when I'm looking at my phone and they've said, well, where are you going? And they'll walk me to where I need to go. Does that mean that I'm part of Japanese culture? No. But do I feel discriminated against? No, I don't. I know that I don't fit in, and I probably won't ever really fit in. I don't plan to have a Japanese boyfriend or husband because I would never be satisfactory to a Japanese.
I'm sure you would, Jenny.
No. But I do find that for the most part, I get by just fine, and people are very hospitable and gracious.
And you feel comfortable there. That's the main.
Oh, absolutely. I feel very safe, very comfortable. It's such a safe culture here. I mean, you see kids on the trains that are going on their way to kindergarten that are 5 years old, that their parents send them off, and that's just part of Japanese culture. And so and
that's in Tokyo.
Oh yeah. Today on the
train. That wouldn't happen. I can't think of any other city that would happen.
Probably not. Other cities in Japan, perhaps, but definitely, you wouldn't.
That would be unthinkable, even in the UK. It would be unthinkable. Anywhere in the States, that would be unthinkable.
New York, no. DC, no. It wouldn't happen. But yeah, here it's kind of a rite of passage to, take your first train trip when you're 5 and you go to kindergarten, and that's just part of life here.
Wow, we've got a lot to learn from Japanese culture by the sounds of this. Yeah.
There's a lot of really good stuff here. There are also things that are, you're like, that's interesting, just coming from my own perspective. But yeah, it's a really just a wonderful, wonderful place to live.
Yeah. Great. Jenny, thank you. I'll pause that there. I'm sure lots of people will be fascinated as usual. You'll be getting huge amounts of comments, I'm sure. And I really am. There was a comment in the last one was like, is she really in Japan, or is she just in the U? I'm like, yeah, I'm really in Japan. I feel like I should take my computer outside. But yeah, I'm not convinced. How are you going to prove you're in Japan? No, I think we're convinced. Your cultural insights are quite excellent, and we've actually seen some pictures. Just tell us where you've taught before, Jenny, because you're quite internationally experienced, aren't you? So I started my career in the U.S. I worked in Washington, D.C. for about 4 years. From there, I went to Venezuela. So I was in Valencia, Venezuela for 2 years. I was in things have gone so tragically badly in Venezuela, haven't they? It must be awful. It's not great. People are just walking out of the country, aren't they? Because they can't eat. It's just if they can walk out of the country. Indeed, I mean, the Colombian border is sealed, and I don't know what's happening on the Brazilian side. But yeah, I know it's awful.
it's tragic.
Yeah.
Yeah, and then I was in Dubai for 3 years. After that, I moved back to the US and I was in Denver for 2 years thinking that this was a fun adventure. And then I was in Guangzhou, China for 8 years.
Wow.
And this is my second year here. Yeah. So.
Yep. So you've got plenty of cultures to compare it to. That's great. Yeah.
I do. Yeah.
Great. Thanks, Jenny. I'm sure you get lots of positive comments. We'll look forward to reading them. And
thank you for having me out.
You do realize you're our special correspondent in Japan now, don't you?
I'm cool with that. And I'm, next time if I get a little more warning, I can check in with my Japanese friends on the ground who watch you as well. Hi, Eileen, our elementary school secretary.
No, say hello to who you want. Go ahead.
Oh, yeah, well, Eileen and all of my my coworkers at ASIJ. Hello, and hi, Mom and Dad, Grandma.
Oh, absolutely. Yeah, don't leave the important people out. Yeah.
Thanks.
Yeah. Jenny, very clearly explained as always, Jenny, and we really appreciate it, and many people around the world do.
Thanks for having me.
Thank you very much.